None of the tests are good enough in and of themselves. So it's really looking at a combination of blood tests, a test looking at cells in the urine, and in many cases biopsies, and looking at the combination of those to really determine where the risk is, so that the appropriate treatment is done. We still do the traditional PSA test. That's one of the screening tests and one of the criteria for a low-risk cancer, but it's not specific to cancer, so many other things can elevate your PSA. There's a new test called a PCA3, prostate cancer antigen test, that is specific to cancer, and that's a test that's done on cells in the urine, and that can identify men who are likely to have a positive result on their biopsy. If you're below the cutoff, then you're unlikely to have it, or if you do have a cancer below the cutoff, it's much more likely to be a low-risk cancer that doesn't require aggressive treatment. And then there's an imaging test, an MRI, which we all know of for backs and knees and other joints, but you can now do what's called a multi-parametric prostate MRI, and that MRI can identify where the cancer is in the prostate gland. So if you need a biopsy, you can get a directed biopsy, and it also identifies the extent of the disease and whether or not the disease has spread beyond the prostate gland itself.